Hello, everyone. Let me begin with a thought. In science, we often say prevention is better than cure. Just as we design safety systems in physics to protect against accidents, in biology too, reproductive health programs are like preventive mechanisms for society. Reproductive health isn't just the absence of disease. It means complete physical, mental, and social well-being in matters of reproduction. Interestingly, India was one of the first countries to launch a national program way back in 1951 called the Family Planning Program. Over time, it evolved into broader strategies that included maternal care, child health, and prevention of reproductive diseases. Just as in physics we need a strong foundation of laws and equations, a healthy society needs a strong foundation of reproductive awareness and responsibility.
Now, let's think about the problems. Imagine building a machine without instructions, confusion, errors, and inefficiency. Similarly, lack of awareness about reproductive health leads to myths, taboos, and unsafe practices. Many adolescents still face health issues like early pregnancy or unsafe abortions. These are just like unstable systems in physics. If the initial conditions are wrong, the results are disastrous. On top of that, our population is growing rapidly, like an unchecked exponential graph, stretching resources to their limits. Add to this the increasing cases of sexually transmitted diseases and infertility, and we see why reproductive health needs urgent attention. So, how do we stabilize this system? Just as in physics we use control mechanisms to bring balance, governments design strategies to manage reproductive health. The Reproductive and Child Health Program, or RCH, was launched to provide safe motherhood, child welfare, and awareness. Along with this, campaigns by NGOs, schools, and media spread accurate information, just like how physics experiments spread clarity about natural laws. From contraception methods, safe abortion services, to laws banning amniocentesis for sex determination, these strategies act like safeguards. They prevent misuse and ensure society moves toward equilibrium, just as damping prevents oscillations from going unstable. Education is the real force here. Think of it like Newton's second law, force equals mass into acceleration. Here, the force of awareness equals the mass of correct information multiplied by the acceleration of its spread through schools, parents, and media. When schools introduce sex education, myths get cleared. When media spreads information about HIV, people learn safe practices. And when women are educated, they make empowered reproductive choices. Just like a guided projectile follows a safe trajectory, awareness ensures that individuals and families follow healthy reproductive paths. Of course, science doesn't stop at awareness. Just as physics gives us rockets, lasers, and semiconductors, medical science gives us tools like IVF, artificial insemination, and surrogacy to solve infertility problems. Techniques like amniocentesis, though misused earlier, are powerful diagnostic tools for detecting genetic disorders like Down syndrome or sickle cell anemia. Vaccines and better obstetric care ensure safe motherhood. And did you know? India developed Saheli, a unique non-steroidal oral contraceptive for women. It's like a breakthrough invention in technology, simple, effective, and empowering. Now let's work through an example, almost like solving a numerical in physics. Suppose we start with a population of 1 million growing at 2% per year. Using the formula, P equals P naught multiplied by open bracket 1 plus a close bracket to the power T, substituting, P equals 1 million multiplied by 1.02 to the power 10, which comes to about 1,219,000. That's an increase of nearly 219,000 in just 10 years. But if we reduce the growth rate to 1%, the population after 10 years becomes about 1,105,000. That's over 115,000 fewer people compared to the earlier case. This simple calculation shows how contraceptive use and awareness can mathematically control population growth, just like adjusting variables in an equation changes the outcome of a system. So let's quickly revise. Reproductive health is about complete well-being, not just avoiding disease. India led the way with family planning and RCH programs. Challenges include lack of awareness, STDs, infertility, and overpopulation. Strategies like sex education, contraceptive use, medical technologies like IVF, and policies against misuse all work together, much like different forces acting in balance, to stabilize society. And just like in physics, where every equation leads us to a deeper understanding of nature, reproductive health strategies lead us to a healthier, more responsible society. I hope you now have a clear picture of how science and awareness join hands to shape not just individuals, but the future of entire populations. See you in the next lesson.